We are Atlas Health, the leading patient assistance platform of medical financial aid automation with a firm belief in health equity for vulnerable populations. That's why we stand behind a mantra of no patient left behind.
Atlas was built by advocates for advocates. We started our journey by sitting in hospitals and infusion centers with our early adopters, observing their existing workflows and taking note of the key challenges they faced.
The patient and advocate situations we witnessed while we were in those hospitals are what drove us to create a mission focused on enrolling patients in the best medical financial aid programs available to ensure every patient could access and afford medical care.
No patient should ever have to make the choice between putting food on the table and affording a critical treatment they need to survive.
Today, we work side by side with our partners and advocate teams, developing customized workflows by taking feedback to our engineering and product development teams. With this approach, we are able to create custom implementation plans based on our partners' needs and enabling them to assist hundreds of patients.
Patient advocates face different hurdles every day, but significant pain points we noticed are time, lack of resources, and the ever-changing nature of patient assistant programs. The time it takes to go from identifying a solution for the patient to the final approval and reimbursement can be discouraging and delays patient care. We as advocates would go home thinking about our patients after hours because there was just too much to get done and not enough time.
We realized very quickly the more we were able to automate the financial assistance process, the more patients we would be able to help in a shorter amount of time and decrease delays in care, though time is not the only resource that is in short supply. Health systems oftentimes do not have full-time employees dedicated to enrolling patients in financial assistance programs. Even when they do, the programs change so frequently with new forms, new eligibility requirements, and new medications assisted, it is challenging to keep up.
Having a database with more programs, including government programs such as QMB, LIS, or Medicaid, charity care and philanthropic that is technology-driven simplifies the patient match and enrollment process.
How often do you spend time searching Google to print off an application just to have a program send it back and tell you that that form was updated last month and will have to be completely redone? We've been there. We've determined that there are many challenges patients and advocates face every day in regard to treatment. However, there are solutions built to support the cause.
Did you know there is over $30 billion in philanthropic programs made available to patients each year? This consists of around 20,000 programs, to include patient assistant programs, copay and diagnosis-based assistant opportunities, state-specific aid, Medicare savings programs, and health equity solutions that help patients access food, housing, travel, and more.
The amount of programs is incredibly promising and changes daily. However, the process to find these programs and enroll patients can be complex and time-consuming. With every day that goes by, the patients accrue balances which cause financial distress and discourage them from continuing their treatment.
Patients begin ignoring phone calls and become unresponsive. They want help, but they're unsure who to turn to, or they're embarrassed to approach the situation proactively. Utilizing Atlas's technology solutions together, we can break down barriers by identifying patient needs and proactively engaging with them, allowing us to work on their behalf. When a patient has an advocate helping them through financial challenges of their healthcare journey, they will get the care they need.
Let's hear from one of our patient advocates, Brandon, on the impact he experienced for a patient with no source of insurance.
We just helped a patient who could not get appropriate care because of a lack of income. So treatment was on hold. We got the access to the free drugs for the patient so they did not have to pay. We were able to start the treatment again. The Atlas software was the main factor in this being able to assist. Not only did it tell me what program would help, but it allowed me to go straight to the right program. It assisted me with having the application, phone number, fax number, along with all the extra documents that would be needed to send in with the application. It also allows anyone who needs to follow up to know exactly where each patient is in the process So if anyone is out for any reason, someone can step right in and finish the process. In a field where time matters, it really streamlines the process and saves countless hours, truly life-saving work.
Next, let's hear another patient story from an Atlas advocate who shares her experience with the time she has been saved.
I noticed a patient on the schedule being treated with Xgeva for prostate cancer. He only had Medicare A and B, so I knew Medicare would only pay 80%. I met up with him one day while he was getting his chemo infusion and told him what we do. After working on his case, we were able to get a foundation grant and pay his out-of-pocket balance. By using the Atlas system, it instantly showed me what assistance programs were available for his diagnosis and the drug prescribed. This made it very easy to choose which program would fit a specific situation. Once chosen, the application is already loaded and pre-filled in Atlas. This is a process that would normally take hours, maybe even days, but I had him enrolled, approved, and started submitting reimbursement requests for his high-cost treatments in less than an hour.
The stories shared from the patient advocates are a testament to the importance of process automation in order to improve access and time to care. Have you experienced a patient that isn't able to come into the facility to sign the needed paperwork because they don't feel well? How about trying to send them a large application and requesting they complete all the complicated information and send it back for processing?
Leveraging technology to optimize authorization, enrollment, and reimbursement is the solution which results in the quick matching of eligible patients to programs they may qualify for, ensuring that all patients receive the appropriate care they need, regardless of social determinants or circumstance.
We match patients early and proactively reach out to them so they are aware of their support contact throughout their treatment journey. Our electronic document and signature retrieval features allow patients to easily enroll into programs without ever leaving their home.
Patients have enough to worry about with their treatment. We think someone else should take on the heavy lifting. Does your current process allow you to text or email patients the most updated program applications, pre-filled with all of their demographic information and questions completed as you worked with them over the phone? The ability to speak with the patients and complete the application, walking them through it step by step, then sending them the completed application forms electronically, prompting them for just a quick signature is a game changer.
We are a full service solution. From commercially insured patients to the uninsured, we provide solutions to assist with every patient journey in more than 20 different disease states. We prospectively identify potential financial burdens at the time of scheduling. Through coverage discovery, we are able to optimize insurance benefits, government assistance, and philanthropic reimbursement opportunities.
From there, we reach out to the patients and have open conversations about their current situations and work to provide them with the best assistance options possible. How does your current process compare? Have you discovered any gaps that can be improved based on this session? Let's see how we were able to assist some of our partners in improving the health equity in their own communities. We enable our partners with the tools to reduce financial toxicity by reaching more patients and making a larger impact on their community. Introducing our partners to a program that improves and automates their existing processes allows for quick and efficient growth in their patient assistance reimbursement, resulting in the drastic declines of hospital bad debt or charity write-offs.
You will notice we have a sampling of health systems in different markets, some small and in rural communities, as well as some larger hospitals in major cities. The Atlas vision to save lives by helping patients access and afford care is not limited to any specific demographic area. Many factors in the current healthcare environment are changing daily, creating obstacles to patients receiving the care they need. Let's work together to improve the communities we serve.
Starting the conversation about creating a full-service financial assistance solution in your health system may seem daunting. However, getting started can be as simple as understanding who your decision maker would be. This could be someone on your revenue cycle team or someone in a leadership position in the pharmacy. These are the key stakeholders who monitor the spend of high-cost therapies and see the financial impact to the patients.
Explore your solution options, request product demonstrations, explore websites, talk to colleagues in the space. Figure out whether you have an existing solution in place and try to understand any limitations or missed opportunities in your current program. Start the conversation and keep trying, because in the end, putting patients first is why we all work in this space. You care about your community and the patients that you serve. You want to make a difference in their lives. Start the conversation is the first step.
You are not alone in this journey. We are Atlas Health, composed of a tenacious team with a unified vision to save lives by helping patients access and afford care to fulfill our company mission of enrolling patients in the best medical financial aid programs available. Come find us. We look forward to connecting with you.
For further information, see our client testimonials and additional solutions for improving health equity with Atlas Auth, Atlas Navigator, and Atlas RX.